Hi, my name is Larry Newman. Why don't you come on in? I'm going to show you a couple of things today. I'm an attorney. Before that, I was a chiropractor. I love playing with spines, and I have my spine model here because today I'd like to talk to you about cervical disc injuries following a car accident and how they happen. Before becoming an attorney, I was a chiropractor. I practiced for 10 years. I've been practicing as an attorney now for 14. What I've discovered about the cervical spine is very interesting in that the first two levels of the spine do not contain any discs. And the reason that between the skull and the first bone and the first bone and the second bone do not have any discs is to allow them the greatest amount of motion. Because we get all our rotation in the neck and head and we're able to turn all the way around side to side because we have no limitations on that movement by having a disc. The discs are there beneath that level, beneath the first two levels. They start and they act as shock absorbers to the spine so that one bone on top of the other, we can absorb some of the pounding that we do when we're walking and moving around all day long. The problem is when we're in an auto accident, whether it's a rear end collision, a front end collision, or a side collision, the shock absorbers in the spine are not designed to handle those type of forces. We're not designed to do that. The spine can only handle so much trauma, and the problem with having trauma that's sudden and abrupt is the body attempts to compensate by spasming down, by splinting to try to protect what's inside, which is the spinal cord. When that happens, we end up having rips and tears, strains, sprains to all the soft tissue elements, the muscles, the tendons, and the ligaments surrounding the cervical spine. In this situation, we can wind up with a disc injury. And disc injuries affect not only the neck, but they can also travel down into the shoulder, the arm, and the hand, and even into the fingers. A true disc injury is going to have what's called radiculopathy. It's going to have movement of pain, movement of symptoms, whether it's numbness or tingling, or weakness in the arm and hand, or the muscles starting to get smaller or shrinking in the arm and hand. Those things are going to happen when we have pressure on the nerves within the neck area. If you have any questions about your New York personal injury case, this is what I do. You can give me a call. You can shoot me an email. I'd love to answer your questions. Thank you.